Over 1 million seniors got dropped from their Medicare Advantage plans this year. Not because they missed a payment, not because they did anything wrong. Their insurance company simply walked away. And most people found out from a single letter that looked exactly like junk mail. If you or your parents are on Medicare Advantage right now, stay with me. I'm going to show you if you are affected and exactly what to do before your window closes. Last fall, Barbara almost made a costly mistake. She was sorting through her mail on a Tuesday afternoon when she found a plain white envelope from her insurance company. She almost dropped it straight into the recycling bin. It looked like junk mail. It was not junk mail. Inside was a notice telling her that her Medicare Advantage plan, the plan she had relied on for 8 years, would not be available in her area in 2026. She had 47 days to find a new plan. She did not know that yet. She thought it was just another piece of paper. If that story sounds familiar, or if you have a loved one who could be in Barbara's situation right now, this video is for you. Something significant happened in the Medicare Advantage world in 2026. Medicare Advantage, which is the private insurance alternative to original Medicare, is sometimes called Medicare Part C. These are plans offered by private companies that bundle your hospital, doctor, and prescription drug coverage into one plan. Many of them offer extra benefits like dental, vision, and hearing that original Medicare does not cover. For years, Medicare Advantage was growing. More insurers were entering the market. More seniors were enrolling. By 2024, more than half of all Medicare beneficiaries were in a Medicare Advantage plan. Then the math stopped working for the insurance companies. 3 of the biggest names in Medicare Advantage quietly announced they were pulling out of hundreds of counties across the country. UnitedHealthcare, one of the largest Medicare Advantage providers in the nation, dropped coverage in 16 states and 109 counties. That affected roughly 180,000 people. Humana went further. Humana pulled out of 3 states and 194 counties. Analysts estimate Humana could lose up to 550,000 Medicare Advantage members as a result. Aetna made similar cuts, pulling back from 1 state and more than 100 counties. When you add it all together, somewhere between 1 million and 3 million seniors have been directly affected. And many of them, like Barbara, almost missed the notice entirely. To understand why this is happening, it helps to understand how Medicare Advantage plans make money. Private insurers get paid a set amount per member by the federal government every month. In return, they agree to cover that member's healthcare costs. The idea is that if they manage care efficiently, they keep some of the difference as profit. For years, that worked well for insurers. Then 2 things happened at once. First, seniors started using more healthcare. After years of delayed procedures during the pandemic, older adults came back to doctors and hospitals in large numbers. The costs went up faster than insurers had planned for. Second, the federal government changed how it calculates payments to insurers. The new formula resulted in lower payments per member, more costs going out, less money coming in. For some plans in some counties, the math no longer added up. So insurers made a business decision. They stopped offering those plans. That is the plain English explanation for why your plan may have disappeared. Let's go back to Barbara. She is 71 years old. She lives in a mid-sized city in the Midwest. She has had the same Medicare Advantage plan since she retired. She liked it because it covered her dental checkups and her eye exams, and her monthly premium was manageable. She paid $28 a month. That is about the cost of a casual restaurant lunch. When she got that notice in November, she set it aside for a week. Life was busy. The holidays were coming. She figured she would deal with it later. It was her daughter who spotted the deadline. Her daughter noticed the date printed at the bottom of the letter, December 7th. That was the last day of the Medicare annual enrollment period. In plain terms, that was the last day Barbara could switch to a new plan without any restrictions. She had 6 days left. Barbara got on the phone. She called her state's SHIP office. SHIP stands for State Health Insurance Assistance Program. It is a free counseling service that helps seniors navigate Medicare decisions. A counselor walked Barbara through her options in 40 minutes. She found a new plan. It was not identical to her old one. The dental coverage was a little different, but she got it done. She kept her primary care doctor. She kept her specialist. The point is, Barbara made it because someone caught the deadline in time. Not everyone did. Here is something important to understand about timing. There are two main windows when Medicare beneficiaries can make changes to their plans. The first is the annual enrollment period. It runs from October 15 to December 7th every year. During this window, you can switch plans, drop your Medicare Advantage plan, and return to original Medicare, or change your Part D prescription drug plan. The second window is the Medicare Advantage open enrollment period. It runs from January 1st to March 31st. During this window, you can make one change to your Medicare Advantage plan, just one. And it closed on March 31st, 2026. If you or someone you love missed both windows, there may still be options, but they are narrower. Now, we want to be clear about something before we go further. Senior Life Decoded is here to help you understand your options and ask the right questions. We are not insurance counselors, and we are not giving you legal or benefits advice. Every person's Medicare situation is different. What applies to one person may not apply to another. With that said, here is something worth knowing about. If your Medicare Advantage plan was discontinued or you lost coverage, you may qualify for something called a Special Enrollment Period, or SEP. We say may because eligibility depends on your specific situation, your location, and the exact reason your coverage changed. A Special Enrollment Period is a limited window outside of the normal enrollment calendar that allows you to make changes to your Medicare coverage when a qualifying life event happens. Losing your plan is one type of qualifying event, but whether you qualify and for how long is something only Medicare or a licensed counselor can confirm for your individual case. In plain terms, if your plan disappeared, it is worth asking whether a special enrollment period applies to you. Do not assume you have missed every option, and do not assume you are covered without checking first. The rules are specific, and they vary based on your situation. This is not the time to guess. This is the time to call someone who knows and can look at your actual circumstances. There is one more piece of this that is easy to miss. Even if your plan survived 2026, your doctors might not still be covered by it. Hospitals and medical practices across the country have also been stepping back from Medicare Advantage networks. They say the payment rates are too low and the administrative burden is too high. More than a dozen major health systems dropped Medicare Advantage plans heading into 2026. What that means in real life is this. You might open January with your same insurance card. But when you call to make an appointment with your cardiologist, you might be told that your plan is no longer accepted there. If that happens, you could face higher out-of-pocket costs, or you may need to find a new specialist. Before you assume your coverage is fine, it is worth a phone call to your most important providers. Ask them directly, do you still accept my plan? Do this for your primary care doctor and any specialists you see regularly. It takes 5 minutes. It could save you a significant amount of money and a lot of frustration. While all of this is happening, the cost of Medicare is going up. The standard Medicare Part B premium increased to $202.90 per month in 2026. That is an increase of $17.90 from last year. That is roughly a 10% jump, the largest increase in 4 years. Part B is the part of Medicare that covers your doctors, outpatient services, and preventive care. To put that in perspective, the Social Security cost of living adjustment for 2026 was 2.8%. That added about $56 a month for the average beneficiary, but the Part B premium increase alone eats up roughly 1/3 of that raise. So if you felt like your Social Security cost of living increase disappeared almost immediately, you are right. This is why understanding your plan and your options matters so much right now. Every dollar you overpay for coverage you do not need or underpay for coverage you do need has a real effect on your monthly budget. Here is what to do right now, depending on your situation. If you received a plan discontinuation notice and have not acted yet, call 1-800-MEDICARE. That number is 1-800-633-4227. Tell them your plan was discontinued. Ask whether you qualify for a special enrollment period. They can tell you within minutes. If you want free, one-on-one help comparing plans, contact your state's SHIP office. SHIP stands for State Health Insurance Assistance Program. The counselors there are not selling anything. They are trained volunteers and professionals who help seniors compare Medicare options at no cost. To find your state's SHIP number, search SHIP Counselor and your state name, or visit shiphelp.org. If you are not sure whether your doctors are still in your plan's network, call their offices directly. Ask, "Do you still accept my plan?" Do this for your primary care doctor and any specialists you see regularly. And if you are an adult child watching this for a parent, this week is a good time to sit down with them. Pull out the insurance card. Find the plan name. Look up whether that plan still exists in their area. You could save your parent a significant amount of stress and money with one afternoon of your time. When Barbara finally got her new plan confirmed, she called her daughter to say thank you. She told her, "I almost threw that letter away. I had no idea." That is exactly how these situations happen. Not because seniors are careless, but because insurance companies do not make these transitions easy to understand. The letters are full of fine print. The deadlines are real but not obvious, and life is busy. You now know what happened, why it happened, and what to do about it. That puts you ahead of the millions of people who still have not connected the dots. If this video helped you, or if it made you think of someone who needs to hear it, please share it. Forwarding this to a family member or a friend could genuinely make a difference in their coverage and their peace of mind. And if you have been through this yourself, we would love to hear your experience in the comments. What happened? How did you handle it? Your story could be exactly what someone else needs to read today.